Welcome back to the deep dive. You know the drill. We sift through a pile of sources so you don't have to, getting you straight to the heart of the matter. Today, we're tackling something that affects a lot of people, often pretty quietly: acid reflux disease. And what really jumped out at us from the research was this idea, framing it as a behavioral problem.
Well,
All right, let's unpack this then.
okay.
Acid reflux. Yeah, most of us think heartburn, maybe some indigestion after a big meal. But why this behavioral problem label? What's actually going on?
That's a great starting point. And yeah, the behavioral angle is really key to getting a handle on this. So basically, acid reflux happens when stomach acid, or those strong digestive juices, flows back up into the esophagus. Now, the main issue, physiologically speaking, is that your esophagus just isn't designed for that kind of acid. Your stomach lining, totally fine, it's built tough. But the esophagus, much more vulnerable. So when acid keeps splashing back up, it causes inflammation, pain, and down the line, potentially serious damage. But here's the thing our deep dive kept highlighting. Most cases aren't because of some fundamental anatomical issue. They're driven, often directly caused, by our lifestyle choices, our habits.
So it's not random. It's us
Yeah.
setting the stage for it. And symptoms was, yeah, heartburn's the classic. But the research we looked at showed a much, much wider range of stuff. It's not just that burning feeling, is it?
No, absolutely not. The symptoms are super varied. And actually, people often don't connect them to reflux at all. They think it's something else entirely. Our sources break them down really well into two main groups. First, you've got the esophageal symptoms. These are the ones, directly happening in the esophagus because of the acid.
Yeah.
So things like a persistent sore throat, maybe trouble swallowing, which can feel pretty alarming, obviously.
Yeah,
And
definitely.
a lot of people report this chest tightness. Feels almost like indigestion, but sometimes it's so bad people worry it's their heart, which is why getting it checked out is so important.
Right. Don't self-diagnose that one.
Exactly. Then there's actual burning pain, often in the upper abdomen, or that really nasty sour or bitter taste coming back up into your mouth. Regurgitation, basically.
Mm-hmm.
Sour burps, bloating, gas. And those are common too. And here's a key point. These symptoms often get worse. They really flare up right after main meals.
Okay, which points right back to the food and behavior link. Makes sense. But you said
Yeah.
two categories. So if it's not just the obvious fire in the chest or even these other throat and swallowing issues, I'm guessing the effects can spread beyond just the esophagus itself. Our sources mention some extra-esophageal things.
Precisely. And this is where it gets, well, really interesting and maybe surprising for some folks. The second category, extra-esophageal symptoms. These are effects outside the esophagus, but still triggered by that reflux. I mean, think about it. If acid's coming up into your throat area, it's bound to affect things nearby, right? So you might see unexplained voice changes or chronic hoarseness. The vocal cords get irritated. A chronic cough is another big one, just this nagging cough that won't quit. And for some people, the research shows a clear link to respiratory problems, like asthma symptoms getting worse, or even triggering asthma in some cases.
Yeah.
Because tiny acid droplets can get inhaled.
Wow.
And yeah, sometimes patients even get chest pain that isn't heart-related, but it's coming from the esophagus. Now, here's the really crucial bit. The thing our sources really stressed, and it's vital, if acid reflux isn't treated, if it just keeps going, it can lead to serious complications,
So,
including
Jesus
Sam.
Christ. Okay.
Yeah, it's not just about discomfort you can ignore or mask with an antacid.
Yeah.
That constant acid irritation can cause changes in the esophageal lining cells, a condition called Barrett's esophagus. It's precancerous.
Right.
And that, unfortunately, can progress to esophageal cancer. So it really underlines why taking this seriously is so important. It's way beyond just needing a Tums.
That's incredibly sobering. It really shifts it from an annoyance to a genuine long-term health risk. It makes understanding the drivers even more critical. So
Yep.
if these are the symptoms and the risks are that serious, and it's framed as behavioral, what specifically are we talking about? What parts of our modern, maybe urban lives are the culprits here?
That's the core question, really. And the research we dove into is pretty clear. A lot of our common daily habits, especially the ones tied to, fast-paced urban living, are direct risk factors. It's like our culture accidentally created the perfect recipe for reflux.
Okay, like what specifically?
Well, fundamental stuff. Irregular eating patterns, for one. Constant snacking or eating at totally different times each day. It messes with your digestive system's rhythm. Your body kind of likes predictability,
Yeah, that sounds familiar. Lunch at the desk, grabbing something whenever.
Exactly. Which leads right into the next one. Wrong eating methods. Specifically, eating too fast, just wolfing food down. Our sources highlighted this, just slowing down, actually chewing your food properly, being a bit more mindful. It makes a difference. Eat too fast, you swallow air, increases stomach pressure.
Right. Right. Makes sense.
Then, obviously, inappropriate food choices. We're talking spicy things, really fatty foods, lots of fried stuff. It's not just generally unhealthy. These foods specifically mess with reflux. Fatty foods slow digestion, keep the stomach full longer, and they can relax that valve, the lower esophageal sphincter.
Ah, the valve letting the acid back up.
Precisely. And spicy food just directly irritates the lining.
So our go-to comfort foods might be fighting back. What about drinks? Coffee, soda?
Yep. Dangerous drinking habits is another major category. The research points fingers at regular alcohol, coffee, those fizzy soft drinks, even tea for some people. Coffee and alcohol are known culprits for relaxing that sphincter muscle. Soft drinks add gas, more pressure, and they're often acidic themselves.
Okay, so the morning coffee and the evening wine could both be contributing.
They certainly can be, yeah. And beyond food and drink, there are other behaviors. Smoking is a big one. It irritates the esophagus directly, cuts down saliva, which normally helps neutralize acid, and weakens the sphincter. Not getting enough sleep can also play a role, maybe linked to stress and digestive disruption. But one the sources really flagged as an important cause, maybe the most common culprit for many: eating right before bedtime.
Ah, the late night snack.
Exactly. Lying down soon after eating means gravity isn't helping keep things down anymore. Much easier for acid to just flow back up.
Man, when you list it all out like that, irregular meals, coffee, quick lunches, late eating, it sounds like, well, normal life for so many of us. It's almost daunting how ingrained these things are.
It really is quite common, which is why reflux is so prevalent.
But okay, the flip side.
Yeah.
The good news is that our deep dive also showed there's a clear way forward. Self-care, things we can actually do. So what's the plan? How do we take back some control?
Absolutely. That's the empowering part. Prevention is key, and the research strongly suggests that you can often manage this yourself. You can relieve symptoms, maybe even treat early stages, just by changing these behaviors. The sources give us pretty clear self-care guidelines. First off, adjusting meal times, making them punctual, consistent, get your body into a rhythm.
Okay, so regularity matters, not just what, but when.
Exactly. Then a really big one, if it applies, lose weight. Extra weight, especially around the abdomen, literally puts pressure on your stomach,
Right.
pushing contents upward. Even losing a little bit can help significantly.
Right, less pressure, less reflux.
Makes sense. Then quit smoking. We mentioned why saliva, irritation, the sphincter muscle, it is reflux on multiple fronts.
Crucial for overall health anyway.
Definitely. And that bedtime eating, the advice is clear. Avoid eating for at least 3 hours before you lie down. Give your stomach time to empty out.
3 hours, okay, that's a concrete target.
But-
Simple, but probably really effective for a lot of people. What about the food itself?
Yet diet-wise, it's about avoiding or seriously cutting back on those problem foods, fatty, fried, spicy things that either relax the valve or irritate the esophagus. And same for drinks. Avoid the beverages that trigger your symptoms. The common list includes tea, coffee, sodas, beer, alcohol. But you kind of have to tune into your own body, see what sets you off, and then, minimize those.
So it's a bit personalized too, figuring out your specific triggers.
It often is, yeah.
Okay, that sounds like a solid roadmap. Direct behavioral changes leading to, hopefully, direct relief. It feels good knowing there's so much we can influence just through our choices. But self-care isn't always the whole story, right? Our sources also talked about when you might need actual medical treatment. When does it go beyond lifestyle changes?
That's a really important point. Self-care is powerful, often the first line of defense, but yeah, sometimes medical help is necessary. It depends on how severe things are, if they persist despite changes, or if there's concern about complications. The research outlines roughly 2 phases for medical help. First, the initial treatment phase. This is usually for milder or initial symptoms. Doctors might prescribe anti-inflammatories maybe to soothe the esophagus, and often acid-reducing medications. These like PPIs, proton pump inhibitors, or H2 blockers. They basically just turn down the acid production in your stomach, giving the esophagus a break and a chance to heal.
Okay, so meds to calm things down and reduce the acid. Makes sense. Works alongside the lifestyle stuff, I guess.
Ideally, yes. But then there's the severe treatment phase. If symptoms are really bad, don't respond well to meds. Or if there's significant damage, like that Barrett's esophagus we mentioned, surgery might be considered. The main goal of surgery is usually to fix or reinforce that lower esophageal sphincter, that valve. Basically tighten it up so it does its job better, keeping the acid down where it belongs.
Right, a more structural fix when needed.
Exactly. And this all leads to a really important recommendation from our sources. If you have symptoms, even if you just suspect you might have acid reflux, especially if it's persistent, go see a doctor. Get it checked out properly. It's not just about managing the burn. There could be underlying issues, abnormalities, or complications that need a professional diagnosis and specific treatment. Don't just rely on self-care alone indefinitely if symptoms continue.
That's a critical takeaway. Self-care is step one, but know when to bring in the pros for the full picture and proper guidance. Smart self-care includes knowing when you need that expert advice. Okay, what a deep dive. We've really unpacked acid reflux disease today, seeing it framed as often behavioral, understand the huge range of symptoms way beyond heartburn, things like coughs, voice issues, and importantly, the serious risks like cancer if it's ignored. But the empowering part is knowing how much control we have through lifestyle changes.
Mm.
Eating times, food choices, avoiding late meals, quitting smoking, and crucially, knowing when medical help is the right next step. Thanks so much for joining us.
If we connect this to the bigger picture, what this deep dive really hammers home is how deeply our everyday choices, what we eat, when we eat, sleep, stress, how much they shape our internal health.
Mm.
It's also as our body is constantly sending us messages
Yeah.
through these symptoms. And it shows we have more agency, more control over our well-being through these daily habits than maybe we realize.
Absolutely. So, thinking about everything we've talked through today, how our behaviors are so directly linked to this, maybe ask yourself, what's one small behavioral change you could maybe try starting now that might make a difference for you? Something to think about.